Today we are going to be walking through how to do your first injection. When you receive your medication, it should come in a pill bottle that looks like this. Your prescription is located directly on the pill bottle, and so you will want to keep that to refer back to it as needed. You should also receive insulin syringes and alcohol wipes. Your medication vial will be located inside the pill bottle and will look something like this. On the top of the bottle, there is a metal piece that you have to take off in order to do your first injection. It can be tricky to get off, but once it's removed, you'll be able to see the plunging area, which is light gray. Again, your prescription is located on the white part of the bottle, so please don't throw this away, or you can snap a picture of it to refer back to as needed so that you know what your schedule is and what dose you should be taking each week. On your syringe, you'll have plastic pieces on each side. You'll want to remove the bottom one first and just toss that. We do want you getting in the habit of cleaning the top of your vial before each injection. You'll do this by wiping it with an alcohol pad, just so it stays nice and sterile before each injection. Next, you need to figure out your dose. For the sake of this video, we will be doing the first injection of Semaglutide, which is 5 units. I do want to remind you to look at your prescription and make sure you know which dose you should be starting with. If you have any questions or concerns about which dose is correct for you, please give us a call. So for a 5-unit dose, you're first going to pull down to the 5 on your syringe with just air, which looks like this. Carefully remove the cap and inject the 5 units of air directly into the vial of medication, like that. Next, you're going to flip the vial of medication upside down and pull down to the number 5 with just medication. You can pull past the number 5 and then push back up to it. We just want to make sure that at the end you have just 5 units of medication. Flip the medication back and remove the needle. If you pull the needle out while the medication is upside down, some of it may leak out. So make sure you flip it back up and then remove the needle from the vial. Next, we are going to choose which area of the body you are going to do your injection. If you're doing it on yourself, a super common area would be the stomach. My favorite place to do an injection on myself is the outer thigh because I can get a good pinch right here. If someone is doing the injection for you, they can do the back of the arm, the buttock, really anywhere that you can get a pinch of fat. We want the needle to go into the subcutaneous layer, which is the fat layer on your body. So inner thigh, outer thigh, stomach, arm, buttock, those are the most common areas. This is Stacy. We're going to be doing her first injection today, and the location we chose for her is the back of her arm. The first thing we're going to do is wipe the area with an alcohol wipe. You're going to pinch the skin, and the quicker you go into the skin with the needle, the less you'll feel it. 1, 2, 3. Push the medication in. I always let go of the skin and hold it there for a second and then remove so that you don't lose any of the medication and you don't bleed. Generally, I'll go over the area one more time with the alcohol wipe and make sure it's clean. And you just did your first injection. You can recap the needle and throw it in the garbage. Unless you have a sharps container, then you can put it in there as well. And because your medication is now open, we do recommend keeping it in the refrigerator.